Hello aspirants, welcome to GDC English classes and welcome to TEJAS series. So this series is specially designed for the aspirants who are preparing for pharma government job, especially pharmacist. I hope there are many notifications are released. So RRB already released and Telangana government pharmacist also released, and in upcoming days there is a chance of 100% of central government health scheme and chance of ESIC. So many number of notification will come. So please be aware and please be on your preparation and come and join to the GDC because you know the strength of quality of GDC. So we providing classes regarding live classes and regarding recorded lectures, test, hard copy materials, everything is there. And only thing is we have to come here. So going into the session, so in this session we will discuss regarding the detailed MCQs explanation on the MCQs of nootropics, muscle relaxants as well as opioid analgesics. As well as opioid analgesics. So the first question, all of the following are CNS stimulants except all of the following are CNS stimulants except so like amphetamines, benzodiazepines, cocaine as well as methylphenidate. Methylphenidate. So as you know, amphetamines. So amphetamines are group of compounds. These are CNS stimulants. Benzodiazepines are sedative hypnotics. These are CNS depressants. Cocaine, a CNS stimulant. Methylphenidate, also a synthetic CNS stimulant. Yes, the answer will be the benzodiazepines not comes under CNS stimulants. So here the CNS stimulants are the different categories. Convulsants. So some drugs by producing excess stimulation of CNS, they may cause convulsions. Like strychnine, example picrotoxin, 𝙂𝙀𝙎𝙬𝙧, pentylene tetrazole. So these drugs what they will do? They inhibit the inhibitory neurotransmission and increase the domination of excitatory neurotransmission. So inhibitory neurotransmitters GABA glycine, excitatory neurotransmitters aspartate glutamate. Next, analeptics, example doxapram. So here these are the drugs stimulate the respiratory system by acting on the central nervous system. And psychostimulants like amphetamines, pimolin, cocaine, caffeine, atomoxetine, modafinil, as well as methylphenidate. So these are the categories comes under the CNS stimulants. Next, CNS stimulant agent belongs to CNS stimulant agent belongs to. So they are respiratory stimulants, also known as analeptics. They are psychomotor stimulants, stimulate the cortex system, especially motor system, and psychomimetics, mimic the psychologically, stimulate the central nervous system. The answer is all of the above. Answer is all of the above. The CNS stimulants can be broadly classified as analeptics. Psychomotor stimulants are methylxanthines like caffeine, and respiratory stimulants and CNS stimulants can also show convulsant effect. So excess stimulation of central nervous system increase the domination of excitatory neurotransmission. Increase the domination of excitatory neurotransmission leads to convulsions, nothing but epilepsy or fits. Next, which of the following drug is not an opioid? So, which of the following drug is not an opioid? This is also simple question. Yes, heroin, diacetylmorphine, ketamine, a general anesthetic, methadone, a long-acting opioid derivative, codeine, mainly having antitussive property rather than analgesic property. So, ketamine is not an opioid category of drug. Ketamine is not an opioid category of drug. So let's see the detailed classification here. So opioid mu receptor agonist, natural opium alkaloids like morphine, codeine, thebaine, papaverine, noscapine. Morphine, codeine, thebaine, papaverine, noscapine. Next, semi-synthetic category of opioids like diacetylmorphine heroin, 𝙁𝙀𝙍, as well as ethylmorphine, semi-synthetic derivatives like diacetylmorphine heroin, 𝙁𝙀𝙍, as well as ethylmorphine. Next, synthetic category directly prepared in the laboratory like pethidine, other name is meperidine, fentanyl, methadone, tramadol, tapentadol, remifentanil, dextropropoxyphene, dextropropoxyphene. So these are the opioid mu receptor agonist under the subclassification of synthetic, semi-synthetic, natural. Next, complex action, nothing but mixed acting drugs. So above list of drugs are, they are different category like natural, synthetic, semi-synthetic, but three different categories. But this category of drugs comes under agonist, but now they are having complex action, mixed action. So like examples of agonist, antagonist, nalarfin, nalbuphine, pentazocine, butarphanol. So nalarfin, nalbuphine, pentazocine, butarphanol. For example, pentazocine is an antagonist at mu opioid receptor and agonist at k opioid receptors. Next, partial mu plus k receptor antagonist, buprenorphine. So buprenorphine is a partial agonist at mu opioid receptor and antagonist at k receptors, k opioid receptor, kappa opioid receptors. And pure opioid antagonist like naloxone, naltrexone, nalmefene. So nalmefene, naltrexone, naloxone are the pure opioid receptor antagonist used in overdose of opioids, poisoning of opioids. And regarding the ketamine is not an opioid. Ketamine is an NMDA receptor antagonist used as a induction agent in anesthesia, whereas other drugs given in options are opioids. And ketamine is known as dissociative anesthetic. Dissociate the person from the surroundings during the surgical procedure and produce hallucination. Ketamine is a dissociative anesthetic. Ketamine having two isomers, R isomer, S isomer. S isomer of ketamine produce anesthetic activity. R isomer of ketamine produce hallucinations. Next. Next MCQ. Select the drug that improves some symptoms in Alzheimer's dementia by increasing the brain acetylcholine level. So simply, which of the following drug helps in the improvement of symptoms in the Alzheimer's disease by increasing acetylcholine levels in the brain? So drugs like the options I mentioned here, pemoline, donepezil, tisergoline, piribedu or piribedil. So here donepezil is a acetylcholine esterase enzyme inhibitor and increase the acetylcholine levels in the CNS and helps in the treatment of Alzheimer's. Helps in the treatment of Alzheimer's. Answer is the donepezil. So let's see here. Donepezil is a cerebroselective, selective on the cerebrum and reversible anti-acetylcholine esterase produce measurable improvement in several cognitive as well as non-cognitive scores in the Alzheimer's dementia. So donepezil is a cerebroselective reversible acetylcholine esterase enzyme inhibitor and helps in the treatment of Alzheimer's disease by increasing acetylcholine in the central nervous system. Which one is a centrally acting skeletal muscle relaxant? So which of the following drug is an example of centrally acting muscle relaxant? Like example like carisoprodol, dantrolene sodium, decamethonium, quinine. So quinine generally anti-malarial drug. Decamethonium, decamethonium comes under the peripheral skeletal muscle relaxant. Dantrolene sodium for treatment of malignant hyperthermia. And answer is a yes, that is carisoprodol is skeletal muscle relaxant by acting through central nervous system. So let's see the classification for more clarity. So peripherally acting neuromuscular blocking agents like non-depolarizing or competitive neuromuscular blockers based on duration of action, long acting deutivocurarin, pancuronium, doxycurium, pipecuronium, and intermediate acting like vicuronium, atracurium, cisatracurium, rocuronium, rapacuronium, and short acting is mivacurium. And depolarizing neuromuscular blockers peripheral succinylcholine, also known as suxamethonium and also decamethonium, and directly acts on the skeletal muscle and produce the action that is dantrolene sodium as well as quinine. Next, centrally acting muscle relaxants. So these drugs causes relaxation of skeletal muscle by producing their action on the central nervous system. Mefenacin derivatives like carisoprodol, chlorzoxazone, chlormazanone, methocarbamol, chlormazanone, chlorzoxazone, carisoprodol. Next, diazepam, diazepam, GABA mimetics, baclofen, thiocolchicoside, GABA mimetic, thiocolchicoside as well as baclofen, and central alpha 2 receptor agonist, tizanidine. So, central alpha 2 receptor agonist as a antihypertensive drugs, clonidine alpha methyl dopa, and as a centrally acting muscle relaxant, skeletal muscle relaxant of alpha 2 receptor agonist is tizanidine. Tizanidine. Next, baclofen selectively acts as GABA A receptor agonist, GABA A receptor antagonist, GABA B receptor agonist, GABA B receptor antagonist. So baclofen is a GABA B receptor agonist. So now itself you saw the baclofen in the classification of centrally acting muscle relaxant. So by agonizing the GABA B receptor, increase the GABA action, increase the inhibitory neurotransmission. By increasing the inhibitory neurotransmission, decrease the muscle contractions, skeletal muscle contraction. So baclofen is a starts with letter B, and baclofen is a agonist of GABA. Baclofen is an agonist of GABA. So here GABA B and baclofen starts with letter B, and baclofen so containing CLO, chlorine. So assume like that. So GABA B receptor agonist means increase the chloride conduction. So increase chloride conduction relax the muscle. Next, regarding the explanation. So baclofen is an analog of inhibitory neurotransmitter GABA and acts as a selective GABA B receptor agonist. The primary site of action is spinal cord. So baclofen directly acts on spinal cord where it depresses both polysynaptic as well as monosynaptic reflexes. As such, it does produce muscle weakness, but it is less sedative compared to diazepam. So as such, it does produce muscle weakness. So decrease the muscle contractions and produce muscle weakness, but it is less sedative when compared to diazepam. Baclofen well absorbed orally, primarily excreted unchanged in urine, having half-life of 3 to 4 hours. Having half-life of 3 to 4 hours. Next, an example of nootropic drug is except. So all are nootropics except. What is nootropic? The agent or substance improves the memory, increases the memory capacity. Nootropics, nose, N-O-O-S, nose means memory, tropic means enhance the memory. The agent or substance enhance memory is nootropic. An example of nootropic is rivastigmine, tacrine, amantadine, pyracetam. So here amantadine. So amantadine is comes under non-nootropic. Rivastigmine, tacrine, pyracetam all are nootropics. The answer is amantadine. So let's see the cholinergic activators like tacrine, rivastigmine, donepezil, galantamine. All these drugs inhibit the acetylcholine esterase enzyme in the CNS and decrease the metabolism of acetylcholine and increase the levels of acetylcholine, which helps in the treatment or decreasing symptoms of Alzheimer's disease. So here cholinergic activators. So these drugs inhibit the acetylcholine esterase enzyme, decrease the metabolism of acetylcholine, increase the levels of acetylcholine. The increased acetylcholine helps in the treatment of Alzheimer's. And glutamate NMDA receptor antagonist like memantine. So there is a G protein glutamate receptors are there, and ion channel glutamate. Ion channel glutamate NMDA AMPA chymeric acid. And miscellaneous category of drugs. Miscellaneous category of drugs like pyracetam, pyretenol, dihydroergotoxin, citicoline, piribedyl, ginkgo biloba. Piribedyl as well as the ginkgo biloba. Next, the drug of choice for hyperkinetic children is. So hyperkinetic means overactive children, hyperactive, excess active. So methylphenidate, nicotinamide, caffeine, clonazepam. So the drug of choice for to control hyperactiveness in the children, the answer is the methylphenidate, a category under CNS stimulant. So methylphenidate considered superior to amphetamine for attention deficit hyperkinetic disorder. So ADHD, attention deficit hyperkinetic disorder in the children, the drug of choice is methylphenidate. Amphetamine is also useful, but over the amphetamine, methylphenidate is preferable. Next, buprenorphine is classified as partial agonist mu receptor, partial agonist at K receptor, full agonist at mu receptor, full agonist at the K receptors. So in the previous slides, we already gone through the classification of opioids. In that, the complex action, mixed actings of opioids. So buprenorphine is regarded as partial agonist at mu receptor, antagonist at K receptors, K opioid receptors. So let's see morphine agonist at mu receptor and weak agonist at kappa receptors and also weak agonist at the delta receptor. The analgesic dose is 10 mg. Nalorphine antagonist of mu receptor and moderate agonist at kappa receptors. Pentazocine partial agonist as well as antagonist at mu receptor and agonist at K receptors. Butorphanol partial agonist at mu receptor, agonist at K kappa receptors. Buprenorphine partial agonist at mu receptor and antagonist at K receptors, kappa receptors. Next, strychnine produce conversions by. So strychnine is known as CNS stimulant. How it is a CNS stimulant? Because so answers option like stimulation of NMDA receptor, facilitating excitatory transmission, blocking the inhibitory transmission, blocking the inhibitory transmission glycine. So strychnine, glycine. Strychnine nathimata blocking the inhibitory transmitter glycine, decrease the inhibitory neurotransmission of central nervous system spinal cord and produce convulsions. Excess, so decreasing the inhibitory neurotransmission, increase the domination of excitatory neurotransmission. So strychnine acts by inhibiting inhibitory neurotransmitter glycine. So strychnine acts by blocking the inhibitory transmitter glycine. Next, strychnine, it is an alkaloid from the seeds of Strychnus noxomica, which is a potent convulsant, can produce convulsions. Strychnine acts by blocking postsynaptic inhibition produced by inhibitory neurotransmitter glycine. So decrease the inhibitory neurotransmission, and promote the excitatory neurotransmission like aspartate glutamate, and excess excitatory neurotransmission may develop convulsions. Next, rave drug. Next is rave drug. Cannabis, cocaine, heroin, amphetamine. Rave drugs nothing but the drugs used in the clubs, and all these are comes under the addictive category of drugs. Addictive category of drugs. The rave drug answer is amphetamine. So let's see the discussion for more clarity. Club drugs, also known as rave drugs, are party drugs defined in the category of recreational drugs which are associated with nightclubs, dance clubs, electronic dance music parties. In the pubs. The most commonly used types of club drugs include MDMA, methylene dioxymethamphetamine, also known as ecstasy, club drug, club name, and Molly. Amphetamine is also called rave drug, and ecstasy or Molly. So club drugs are rave drugs used in the pub culture, dance parties, for recreation of memories, for excitation mode, for stimulation mode. Which drug is not used in Alzheimer's disease? So, among the following drugs, which drug is not used in Alzheimer's? So, drug like pyridoxine, galantamine, donepezil, rivastigmine. So, galantamine, donepezil, rivastigmine are the drugs useful in the treatment of Alzheimer's, but not pyridoxine, but not pyridoxine. So, let's see the discussion. Drugs used in Alzheimer's disease. So especially choline esterase inhibitors like tacrin, rivastigmine, donepezil, galantamine. Tacrin, rivastigmine, donepezil, galantamine. These are the choline esterase enzyme inhibitors and increase the acetylcholine levels. Next, nootropics. The substance or agents enhance the memory, cognition enhancers like pyracetam, aniracetam. Next, NMDA receptor antagonist like memantine. NMDA receptor antagonist like memantine. Next, others like pyribedyl, ginkgo biloba. Pyribedyl, ginkgo biloba also comes under drugs for treatment of Alzheimer's disease. Which of these effect is mediated by mu opioid receptor? So there are three types of opioid receptors like mu k delta receptors. So mu receptor having different function, delta receptor having different function, kappa receptor having different function. Okay. So which of this effect is mediated by mu opioid receptor? Mydriasis. Mu opioid receptors produce meiosis, constriction of pupil of eye. Mu opioid receptors produces euphoria, highly the excitable state of well-being, not dysphoria. Mu opioid receptors decrease the urine output but not produce diuresis, increase the urine output. Respiratory depression is effect of mu opioid receptor. There are three types of opioid receptor like mu k delta. All these three belongs to G protein couple receptors. They activate inactive G protein and decrease the pain sensation, pain perception, analgesic. So the answer is respiratory depression. Mydriasis, not mydriasis, meiosis produced by mu receptors. So let's see here for getting clarity. So there are three types of opioid receptors and all are belongs to the G protein couple receptors. So mu opioid receptor produce analgesia, spinal level as well as supraspinal level, and mu opioid receptor inhibit the GI motility and produce constipation. Mu opioid receptor may cause respiratory depression, may cause sedation, may lead to constipation, may lead to meiosis, constriction of pupil of eye, may lead to euphoria, the state of well-being, highly excitable state, and high doses may lead to dysphoria, opposite to euphoria. And K receptors involves in analgesia, decrease the gastrointestinal motility, respiratory depression, sedation, meiosis, dependence, psychomimetic nothing but CNS stimulant, dysphoria at high doses, and physical dependence. Coming to delta receptors, analgesia, loss of pain, reduced gastrointestinal motility, respiratory depression, affecting behavior, pro-convulsant action. There is a chance of convulsion of delta receptors due to excess stimulation of delta receptors. Which of the following are naturally derived opioids? Which of the following are naturally occur opioids? Diacetylmorphine, heroin, ethyl morphine, morphine, phalcodone. Simple morphine. Simple that is morphine. Naturally derived morphine is naturally derived opioid is morphine among the options. So as you know already, Morphine is a strong opiate that is found naturally in the opium, is a dark brown resin in the poppies, opium poppy. It is mainly as a analgesic, the medicine for the pain, the medicine for the pain, analgesia, pain relief. Next, pyretenol, pyrethiazine used as analeptic, cognition enhancer, anti-epileptic, antidepressant. So the answer is the cognition enhancer. Pyrethiazine is an cognition enhancer known as nootropic. Enhance the memory. Enhance the memory. So the classification we already gone through same classification. So pyretenol, a pyridoxine disulfide or pyrethiazine, a sulfohydral containing compound, a dimer of 5-thiopyridoxine, pyretenol. It is a sulfohydral containing compound. Yes, I hope you know the details of our pharmacist coaching. So there is a 200 live classes are available and recording lectures will be provided and 400 online test series as well as previous year MCQs, and you will get hard copies materials also. So whatever the pharmacist exam you are preparing, and we are ready to providing the coaching to you. But it is mentioned as RRB, but mostly around 90, more than 90% of syllabus is similar to the all types of pharmacist exam, and especially the Telangana pharmacist exam vacancies also released around 600 plus, and the advantage for the Telangana pharmacist exam is there is no non-pharma, only pharma, 100% pharma syllabus, pharma subjects questions only. Okay. Okay, so this is the contact number for more details, and you can contact this number, that is 799-531-8103. So I am the coordinator of GDC English classes. So GDC English classes specially designed for the students from the South India region who are preparing for GPAT, NIPAR, Drug Inspector as well as Pharma competitive exams. Okay, and going forward, opioid stimulation causes, opioid, opioid stimulation causes. Opioid stimulation causes increased heart rate, increased muscle tone, mydriasis, respiratory stimulation. Opioid stimulation causes increased muscle tone, increased muscle tone. So let's see here, depressant action as well as stimulation. Analgesics, sedatives, respiratory depression, antitussive, hypothermia, fall and blood pressure. So the depressant actions of morphine, analgesia, decrease the pain, sedation, reduce sleep behavior, respiratory depression, depress the respiratory system, antitussive, depress the cup center, hypothermia, decrease the body temperature, fall in BP by decreasing the vasomotor tone, and on CTZ, stimulation of chemoreceptor trigger zone, nausea and vomiting, and causes meiosis, constriction of pupil of eye, and stimulation of vagal center produce bradycardia, decreasing heart rate, cortical area and hippocampus, muscle rigidity as well as convulsions, muscle rigidity as well as convulsions. Which opioid analog is non-analgesic in nature? Generally, opioids are the category of drugs. They produce analgesia, pain relief. But one of the drug is not an analgesic. It is a non-analgesic. Does not decrease the pain. Morphine, codeine, fentanyl. Yes, the answer will be definitely thebaine. Answer will be the thebaine. So let's see the discussion here. So we already gone through the classification of like this in the previous slides. So opioid, natural, semi-synthetic, synthetic, opioid, mixed acting drugs, and partial mu receptor agonist, buprenorphine. So the star marking, especially drugs like thebaine, papaverine, noscapine, does not having analgesic property. Does not having analgesic property. These are non-analgesic from the opioids. Which of the following is action of morphine? So which of the following is an action of morphine? Euphoria. Yes, morphine produces euphoria, a state of well-being, highly excitable state. Morphine produces hypothermia, decreased body temperature by showing action on thermoregulatory center in hypothalamus. Analgesic and calming effect, decrease the pain as well as calm down the person. So the answer is all of the above. Answer is all of the above. So let's see the discussion. Morphine has site-specific depression as well as stimulant action on CNS by acting through the mu-opioid receptors. So the mu-opioid receptors are belong to G-protein couple receptors, and there is activation of inactive G-protein. Stimulation of inactive G-protein, nothing but G-alpha I or not, decrease the pain perception. Depressant action, analgesia, calming effect, euphoria, feeling of well-being, a state of excitation, sedation and respiratory depression, cough suppression and hypothermia, cough suppression and hypothermia, reduction in body temperature. Next, the trick. Morphine causes meiosis on eye, constriction of pupil of eye. Morphine by acting on the spinal level and supraspinal level produce analgesia, pain relief. Morphine by acting on lungs, respiratory depression. Morphine may lead to physical as well as psychological dependence. Morphine increases the release of histamine that leads to hypotension, low BP, as well as itching reactions. And morphine decreases the body temperature, hypothermia. Morphine may, by stimulating the CTZ, chemoreceptor trigger zone, produce nausea and vomiting. Morphine produces euphoria, the state of well-being, excitable state. Morphine may produce cough suppression, especially like codeine, suppressing the cough center. And morphine produces constipation by decreasing the gastric movements. Morphine stimulates the vagus nerve and causes bradycardia. And morphine may produce a sedation hypnosis at high doses. At low doses, morphine produces euphoria, the state of well-being. But at high doses, morphine produces sedation hypnosis, that is dysphoria, opposite to excitation. Depression, dysphoria means depression, sad mood. So next question is, the decreasing order of narcotic action of the following is, the decreasing order of narcotic action of following is morphine, codeine, papaverine, narcotin, thebaine. Morphine, codeine, thebaine, papaverine, narcotin. Morphine, papaverine, codeine, narcotin, thebaine. Morphine, papaverine, narcotin, codeine, thebaine. Here explanation. Regarding explanation, morphine greater than papaverine greater than codeine greater than narcotin greater than thebaine in the production of analgesic, pain relieving property. So opioid analgesics are opioid analgesics are natural, semi-synthetic, synthetic drug which are obtained from the crude extract of papaver somniferum. Papaver somniferum contain phenanthrene derivatives, phenanthrene alkaloids like morphine 10%, codeine 0.5%, thebaine 0.2%, and benzoisoquinoline derivative, papaverine 1%, noscapine 6%. Papaverine is a smooth muscle relaxant and papaverine is a inhibitor of phosphodiesterase enzyme 4 enzyme. Phosphodiesterase enzyme 4 type. Okay, so phenanthrene alkaloids, morphine, codeine, thebaine, MTC, benzoisoquinoline derivatives, papaverine, noscapine, and noscapine is high percent 6%. In case of phenanthrene, morphine is high percent 10%. True True statement regarding methadone except. All are true statements regarding methadone exception. It is a long-acting mu receptor agonist. Okay. It is probably incapable of giving a kick means euphoria, excitation. The primary use of methadone, relief of chronic pain. The onset of analgesia is 30 to 60 minutes on IV and 1 to 2 hours after oral administration. After oral administration. Yes, the answer is the primary use of methadone is not for relieving the pain. It is not for intention of relieving the pain. It is to control the opioid withdrawal symptoms. So it is a long-acting mu receptor agonist. Yes, it probably incapable of producing a kick, euphoria, and the onset of analgesia 30 to 60 minutes on IV and 1 to 2 hours after oral administration. That is true. The wrong is it is not primary choice for controlling the pain. Let's see the discussion. Methadone, pharmacologically similar to morphine, has less addiction property, acting as a full mu receptor agonist. Onset of action approximately 30 minutes after ingestion. It do not give any euphoric effect. It is long-acting analgesic given by intravenous, subcutaneous as well as rectal. Methadone primarily used as a substitute for opioid dependence. So it used to control opioid addiction as well as opioid dependence. That is 1 mg. 1 mg methadone is substituted with 4 mg morphine, 2 mg heroin, 20 mg of Petern. It also blocks NMDA receptor and reuptake monoamine ability to relieve neuropathic and cancer pains. So it can block NMDA receptors as well as it can inhibit the reuptake of monoamines. It can inhibit the reuptake of monoamines and helps in the relief of neuropathic as well as cancer pains. So that is regarding methadone. So methadone is a drug of choice for the opioid dependence. If person is depend on the opioids for his purpose, for his own purpose to get kick, to get euphoria, state of well-being. All are opioids except. So the question also very simple. All are opioids except heroin, methadone, Petern, mirtazapine. So mirtazapine is a atypical antidepressant category of drug, and heroin, methadone, Petern comes under the opioids category. So the same classification we already gone through many times, and mirtazapine is a atypical antidepressant. So typical antidepressants acts by inhibit the reuptake of neurotransmitter from postsynapse to presynapse and increase the levels of monoamines in the postsynapse and helps in the treatment of depression. But atypical antidepressant, they block the autoreceptor, increase the release of neurotransmitter. Generally, autoreceptors, also known as presynaptic receptors, when autoreceptors are activated, they inhibit the release of their own neurotransmitter. But when autoreceptors are blocked, they increase the release of neurotransmitter, especially increase the release of monoamines, and increase the release of monoamines helps in the reduction of symptoms of depression. Next, wooden wooden chest syndrome is associated with which of the following drug, like codeine, like morphine, like naloxone, like Petern. Wooden chest syndrome is associated with which of the following? So the answer is morphine. So let's see the discussion. What is wooden chest syndrome? It is a truncal rigidity, trunk rigidity result in decrease thoracic compliance, thereby interfere with breathing. The chest syndrome, nothing but chest syndrome interfere with breathing. Morphine being a highly lipid soluble drug, enhance the tone of large trunk muscles, causing wooden chest syndrome. A neuromuscular blocker or opioid antagonist may use it to overcome truncal rigidity. So this truncal rigidity, the rigidity of the chest muscle, lung muscle become rigid, unable to move properly. So the treatment for this wooden chest syndrome is a neuromuscular blocker like D-tubulin or succinylcholine or opioid antagonist like naltrexone. Opioid antagonist like naltrexone. So here you can see the discussion. The risk factors for wooden chest syndrome is so rapid IV administration of drug, so critical illness, lipophilic opioids, especially usage of lipophilic opioids like fentanyl, remifentanil, sufentanil, concomitant use of medicines that modify the dopamine levels, and extremes of age, high cumulative dose of the fentanyl. All of the following are use of naloxone except. So naloxone, naltrexone, nalmefene are the opioid receptor antagonist, especially for treatment of opioid overdose, poisoning of opioids. So all of the following are use of naloxone except diagnosis of opioid dependence, morphine poisoning, to reverse respiratory depression due to intraoperative opioid use, opioid blockade therapy for post addicts. Post addicts. The answer is so all of the following are use of naloxone. So diagnosis of opioid dependence, morphine poison, to reverse, to overcome, to control respiratory depression due to intraoperative opioid use, especially during the delivery. So during the delivery process, to control labor pain, opioids may be given. That opioids may cause problem in the newborn respiration. Newborn respiration. Naloxone used for the opioid blockade therapy in the post addicts. And the drug of choice for morphine overdose used to reverse neonatal asphyxia due to opioids used in labor. Neonatal asphyxia, a problem in the respiration in the newly born baby, and diagnosis of opioid dependence and beneficial in the reversing hypertension. Beneficial in the reversing hypertension, make low BP to high BP. So excess usage of morphine may develops low BP. So here our question about naloxone, but naltrexone used for opioid blockade, and remaining all are clinical applications of naloxone. High dose of morphine used without much tangerine. High dose of morphine is used without much danger in gallbladder surgery, labor, myocardial infarction, head injury. So without any doubt, so the morphine can be helps in the treatment of myocardial infarction. In the myocardial infarction, there is a chance of pain. That pain can control by morphine. Answer is myocardial infarction. Morphine should be given promptly in myocardial infarction in high dose to allay apprehension and reflex sympathetic stimulation. Apprehension, the feeling of illness. Apprehension, the feeling of illness. About other option, morphine should be used cautiously in gallbladder and bile tract dysfunction, and used during labor. Morphine can cause neonatal respiratory problems. Head injury is a contraindication for morphine use. So if person is suffering from any head injury, any accumulation of excess fluids in the cerebrum, then morphine is not useful. Morphine is contraindicated in that case. Morphine is contraindicated in that particular case. Okay, next. Which one of the opioid has maximum plasma protein binding capacity? Maximum plasma protein, morphine, sufentanil, fentanyl. Sorry, answer is the sufentanil. Which one of the following opioid having maximum binding capacity to plasma proteins? Plasma proteins like albumin, globulin, lipoproteins, etc. So sufentanil having nearly 90% binding capacity to the proteins, plasma proteins. Plasma proteins like albumin, globulin, etc. regulate the drug concentration in the plasma. If the drug is highly bound to plasma protein, it having less distribution in the plasma. If drug is less binding to plasma protein, it having high distribution in the plasma. If drug is highly bound to plasma protein, if drug is highly bound to plasma protein, if a drug is highly bound to plasma protein, then it having low volume of distribution. If drug is less bound to plasma protein, it having high volume of distribution in the plasma. Yes, these are our materials regarding theory as well as fingertips hard books. Theory, competitive theory as well as MCQs objective book. You can get hard copies along with your reasonable fees. And I already mentioned my contact number here. I hope do you know that. Yes, 799 531 8103 is my contact number. For more details, you can contact me. So I am from the Andhra Pradesh. Which of the following action is ascribed to delta type of opioid receptor? Mu K delta opioid receptor 3 are there. So supraspinal analgesia, respiratory depression, euphoria, reduced intestinal motility. Which of the following action is ascribed to delta type of opioid receptor? I hope definitely. So analgesia is common, but answer is the supraspinal, outside the spinal cord. Spinal means within the spinal cord. Supraspinal means supra, other than spinal. So here, the actions of the mu k delta receptors we already gone through in the previous slides also. Which of the following is centrally active muscle relaxant and belongs to mephensin group? Carisoprodol, chlorzoxazone, methocarbamol, diazepam. Which of the following is centrally active muscle relaxant and mephensin group except, so carisoprodol, chlorzoxazone, methocarbamol, all are belong to mephensin group and all are muscle relaxant, but diazepam is belongs to benzodiazepine category and it is a muscle relaxant. So diazepam acting as a muscle relaxant by stimulating GABA A receptors, gamma aminobutyric acid A receptors. The answer is diazepam. Diazepam not belongs to mephensin group. It is belongs to benzodiazepine group. So mephensin group like mephensin, carisoprodol, chlorzoxazone, chlormazanone, methocarbamol, benzodiazepines, diazepam, GABA derivatives, baclofen, 𝘖𝐿-𝘋𝐼𝑔, central alpha 2 receptor agonist, tizanidine. This is the classification of centrally acting muscle relaxant. This is the classification of centrally acting muscle relaxant. Next, mechanism of action of nootropics. Mechanism of action of nootropics. Nootropics stimulate the spinal polysynaptic reflex. Cerebral protectors improving the cerebral circulation. Depress the spinal polysynaptic reflex. Acts on mu K delta receptor but high affinity for mu receptor. So here nootropics enhance the memory, improves the memory capacity. So here these nootropics cerebral protects. They protect the cerebral neurons and also improves the blood circulation to cerebral cortex and helps in the decrease of symptoms of Alzheimer's disease. Helps in the decrease of symptoms of Alzheimer's disease. Mechanism of action of nootropics. Mechanism of action of nootropics. So nootropics like pentoxyphylline, pyretenol, cyclamate, nicergoline function like cerebral protectors, increase the blood circulation to cerebrum that involves in the memory regulation. Nootropics are smart drugs, enhance the memory, attention, creativity, cognitive performance by affecting the synthesis and receptor binding of neurotransmitters in the brain. Receptor binding of neurotransmitters in the brain. So they stimulates the memory power, increase the memory power. Which of the following agent is an example of natural nootropic agent? Which of the following agent is an example of natural nootropic agent? Like modafinil, pyracetam, armodafinil, caffeine. So an example of natural nootropic. So modafinil, pyracetam, armodafinil all are mostly synthetic, maybe semi-synthetic. But caffeine is naturally from the coffee leaves and it is a CNS stimulant. Stimulate the central nervous system by blocking adenosine receptors in the CNS or inhibit the phosphodiesterase enzyme. Inhibit the phosphodiesterase enzyme. Adenosine. Adenosine in the CNS produce sleep, but caffeine block adenosine receptor, prevents binding of adenosine to the receptors in the CNS and controls sleeping, produce stimulation, excitation. So the natural agents like caffeine, bacopa, moneri, brahmi, certain L-theanine and rhodiola rosea, panax, ginseng, ginkgo biloba, ginkgo biloba. Next, synthetic agents like pyracetam, ceticoline, levetiracetam, or modafinil, ampakines, cerebrolysin, phenibut, modafinil, salicylic, semax, inositol, etc. The natural agents caffeine, bacopa, moneri, brahmi, creatine, L-theanine, rhodiola rosea, panax, ginseng, ginkgo biloba. Next, synthetic agents like pyracetam, ceticoline, levetiracetam, or modafinil, ampakines, cerebrolysin, phenibut, modafinil, salicylic, semax, inositol. So these are list of natural as well as synthetic memory enhancers, synthetic nootropic agents. Next, so morphine derivative 80 to 100 times more potent than the morphine compared to morphine. Morphine derivative, which of the following is 80 to 100 times more potent? Methadone, fentanyl, codeine, loperamide. So 100% fentanyl. Fentanyl is highly potent drugs having fast onset of action, control the pain immediately, relieve the pain immediately, produce analgesia within short period of time. Fentanyl, alfentanyl, ramifentanil, sufentanil, all these are the category of drugs shows action within short period. So the answer is fentanyl. So a petrin derivative and fentanyl is a derivative of petrin, also known as meperidine. Petrin also known as meperidine, and fentanyl is 80 to 100 times. So a petrin, fentanyl is a petrin derivative. So fentanyl is an petrin derivative. It is more potent than morphine. So what is potency? The amount of dose required by a drug to produce its action. So the amount of dose required by a drug to produce its action. So morphine requires 10 mg to produce its action, and fentanyl is 80 to 100 mg times more potent. So maybe fentanyl requires less than 1 mg. The transdermal patch of fentanyl for treatment of cancer and other types of chronic pains. Remifentanil is fast-acting derivative of fentanyl. Compared to fentanyl, remifentanil is very rapid action, shows fast action, shows fast pain relief, fast analgesic, loss of pain, loss of pain. So this is regarding our session on the discussion about MCQs of nootropics, centrally acting muscle relaxants along with opioids. So regarding pharmacist, already RRB released. The chance of RRB exam in the December or January, and Telangana already releases grade 2 pharmacist vacancies 633. Very huge number within the state. So RRB is total central, total countrywide 200 plus. but Telangana 600 plus. So very excellent opportunity for the people from Telangana, and even the students from Andhra also, Andhra Pradesh also they can eligible. So that is around 5% will be there. So among 600 seats, the 5% reservation for the other state students. So for details you can contact me, already I gave the number. So subscribe to GDC English classes. So from now onwards, please be serious for 1 year. Within 1 year there is a number of notifications for pharmacist exams. Already RRB and Telangana are there, and upcoming CGHS central government health scheme, and also chance of ESIC, and 100% there is a chance of drug inspector in upcoming days. Maybe some other notifications also will come. Notifications will come and go, but you have to be in the preparation to reach your goal, and GDC is the best place to reach your goals. We are providing the live classes, we are giving the recording lectures, we are giving the practice test, and we are giving hard copy materials, all for with a reasonable price less than 4,000, and we will also having the discount. For more details you can contact me on given number. Okay, and subscribe to GDC English classes. So share with your friends regarding our coaching details and regarding our platform details also. So if you want any details, you can contact me on given number. Yes, this is my number here. That is 7995318103. So don't waste your time. The competition is very very high. So take the coaching. Definitely it will help you, because to get monthly 45,000 to 50,000 rupees per monthly, 4,000 is very very small matter. Because yes, you are talented, I can understand, but competition is very very high. To avoid the competition, you should be in the continuous preparation. Okay, so all the best. Subscribe to GDC English classes. Thank you.